Technology, as there is an increase in the level of skin disease today, almost everyone come across a situation where they have rash, illness, which needs the medical attention. Now is when dermatology will have more demand than ever before. So homeopathy in dermatology, because of recurring recommendation and side effect of the existing methods, it is less expensive, no recurring expenditure without any side effects. We have scope in the following areas: hair fall, alopecia, dandruff, tinea, vitiligo, warts, acne, keloid, psoriasis, chalamasma, and etc. In the nail conditions, brittle nail, deformed nail, decoloration of nails, cosmetic allergy, and complications. So, in homeopathy, you can treat any skin disease. You can name it, you can. So, it is not like that I have done something, it cannot be treated. If it is not mentioned here, like you can treat. Bullous pemphigoid, we can treat. Any other skin cancer, we can treat. There is a possibility. So, dermatology, why did I choose to present on this subject? As many of you know, treating skin condition disorders can be challenging. I believe they are significantly more difficult to treat without the aid of homeopathy. So, for many years now in my practice, 13 years, I have focused on and researched the homeopathic treatment of skin conditions and have gathered numerous before and after pictures of various skin disorders among my own patients. I recently felt to share my findings with my colleagues in hopes that they will benefit from this information. So, what is dermatology? So, dermatology is the branch of medicine dealing with the skin. It is a specialty with both medical and surgical aspects. A dermatologist is a specialist medical doctor who manages diseases related to skin, hair, nails, and some cosmetic products. So, common skin diseases in everyday practices. So, when you sit in the clinic, putting the name as a skin clinic, these are the complaints of these are the skin diseases. Fungal infection, acne vulgaris, alopecia areata, psoriasis, vitiligo, urticaria, scars, chickenpox, hair fall, chalamasma, melasma, boils, corns, warts, impetigo, keloids, lichen planus, dandruffs, skin tags, etc. There are so many diseases other than this. So let us see some 2-3 diseases definition and what exactly happening in the world. So let us come up with a very common skin disease, acne vulgaris. What we commonly see in the pimples, what we call in the common generation. So this is the case of acne vulgaris. So angoid. So acne is also known as acne vulgaris. It is an inflammatory disorder of polysebaceous follicles which usually occurs in the adolescence of both sexes. It is very common skin disorder which commonly presents with the inflammatory and non-inflammatory lesions. It primarily affects skin with a relatively high number of oil glands, including face, upper part of the chest, back, resulting appearance can lead to lack of confidence, anxiety, reduced self-esteem, and in extreme cases, depression or thoughts of suicide. So, acne vulgaris cannot be only seen on the faces, you can see on the chest, backside, or any part of the body, what we commonly call it as the pimples. They are all inflammatory disorder. In 2015, acne affected approximately 633 million people globally, making it the 8th most common disease worldwide. This is the 8th most common disease in the worldwide. Acne commonly occur in adolescence and affect the estimated 80 to 90% of the teenagers in the Western world. Children and adults may be affected before or after puberty. Although acne becomes less common in adulthood, it persists in nearly half of affected people into their 20s and 30s. And smaller group continues to have a difficulty in their 40s. So what they are mentioning, this is a commonly seen up to 2021. After that, there is a affected according to that the names are mentioned. Fungal infection have worldwide distribution, common affecting more than 1 billion of people every year. So difference when a patient comes to the clinic, we are confused with the what is the fungal infection. Confirmation differential diagnosis means some TN candidiasis